a partner, Dr. Green, and he provides valuable orthopedic services to the Barstow community. And I'm really thankful that he has been doing that. He's much involved with the community, with the Barstow, as well as in Apple Valley, Victorville. So I'll have him come to this, here and see how he can give us some inputs about his some of the lectures and give us enlighten about the orthopedic problems and how he can help us. Dr. Lou here.
Thank you very much. So again, my name is Thomas Liu. I'm an orthopedic surgeon. And first of all, thanks again to the Garden for throwing this fair, and of course, Barstow Community College for providing the venue. In case that for folks you don't know, orthopedic surgery essentially is an art of treating injuries with muscles and bones and joints. And so one of the most common things that I do is joint replacements with hips and knees. So general orthopedic surgery, along with that, along with basic fracture care, which I've been providing, at Barstow Community Hospital for ever since I've been here about 8 or 9 years ago. That's Dr. Garden alluded to, and I've been I feel privileged to continue to help that. But my specialty training is actually in sports medicine, so that also opens a whole different realm of in terms of surgeries and local community involvement. Specifically, as you may have heard about arthroscopic surgery, basically minimally invasive surgery that you do with small poke holes, one hole for the camera, one hole for the instruments, and we can get a lot of things done. So a lot of times you see people say, "Oh, I just had a knee surgery," and you see these 2 little holes in the knee and 3 little holes around the shoulders. That's what I do. You do need, specialty training in order to do that, at least do that reasonably well with more complex stuff inside. But it's amazing, with the advent of arthroscopic surgery that we can do a lot of things really invasive and help patients get better, consistent recovery without, with minimizing complications. But along with that, I also be involved with a lot of the teams because that's what my passion is. So when I was training in Pittsburgh, I worked with the Steelers and the Penguins, along with the 4 major universities. And with that experience, I bring it over here, and I'm the head team physician for Victor Valley College. But I also have been privileged, especially with the Garden support, working with a lot of Barstow Community College athletes. And Rachel Kirkpatrick, who's our excellent head athletic trainer. I've been working very closely with her. Again, as recently even talking about one of our athletes that's recently on the way over here this morning. So and along with that, I'm also very passionate about high school athletes because that's a population that a lot of times I feel like they're really underserved. I mean, they're really one of the last group of people who really play it for the love of the sport. Even when you get to college, you start looking at the next level, right? And start to get a little red tape and politics, but these kids, they sometimes they just have, really just do it for the game, do it for the team, do it for camaraderie, and really not no really true aspiration of competing at the next level. And unfortunately, a lot of times there's not enough coverage for that. So I take care of 4 high school football teams in the area. Those are Serrano High School, Oak Hills, Hesperia High School, and Apple Valley High School. But again, I do take care of other high school kids from all over. We try to let the athletic trainer know that there's a free clinic for high school kids year round. Okay, so for football season, obviously that's one of the sports where you expect a lot of injuries. During those times on Saturdays, essentially the morning after the game is from 8:30 to 10:30. All right. So any athlete, any high school athlete can come in for a free evaluation. Right? They can come in with a parent or a guardian, so that they can just get looked at, just make sure there's nothing terribly wrong. When they're outside of football season, when our last cover team exits the playoffs, then they'll go back to Wednesdays year round from 3 to 5 o'clock. Again, year round free clinic for high school athletes. So that's my connection with community. And I just want everyone to know, again, Barstow Community Hospital is a good place, for basic fracture care. We're not a trauma hospital. We're not here to take care of horrific life-threatening injuries, but again, regular fractures. Please remember that we do have the capability to take care of basic fractures. All right. Thank you very much for your attention.
Thanks, Dr. Lou. So I think, as I said that orthopedic surgery services are available in for our Barstow. And I think, it's very nice that because, I want to maybe have most of the healthcare services provided in the community. So I really appreciate that he's been part of the community and helping us out. So now I'll have our vascular surgeon, Dr. Cassie. That's for the short name I call him. And I'm very blessed to have the vascular surgery in our town. They have been in the community for the last 3 months, and I think it's all the good luck of the Barstow, I would say, or God's blessings that Barstow has one of the top famous vascular surgeons of the country practicing in Barstow. And I think Dr. Cassie can introduce himself and talk about. I'm so blessed to have his services at the hospital. We are enjoying it, we are loving it, and believe me, all the patients he sees and does the surgery, I think it's a real God's blessing. I can't say anything more. He's a blessing to the community. Dr. Cassie.
Thank you, Dr. Gordon. Dr. Gordon's been very instrumental in bringing me here, getting us all the facilities so we could work locally. So I have a long name, but I go by Cassie. It's Kasi. So my specialty is vascular surgery. People get confused when I say vascular surgeon. They think I'm a cardiovascular surgeon. Vascular surgeons operate on all blood vessels but the heart. So everything but the heart. So the question is, so what are the blood vessels that I can work on? What do I fix? What do people need to be worried about? So outside the heart, there are millions of blood vessels. So let's just start very briefly. I can work on the blood supply going to the brain. So people who can possibly have strokes, about a third of them happen because people have blockages of blood supply in your neck. Now I'll come to how we can find these out before you have a stroke. And stroke, people don't know this, but in the United States, it's the #1 cause for long-term disability in the United States. So you want to prevent stroke. You don't want to treat stroke. Once it happens, it's over. Then if you come down a little bit, there's a lot of people that I see who require dialysis. Incidence of kidney failure is going through the roof in America, because of hypertension, diabetes, obesity, high cholesterol, all things that we don't take care of. We have a dialysis clinic here. We have 3 dialysis or 4 dialysis clinics if you go just a little south. And all these people need to be connected to an artificial kidney, so their kidneys are working. And to do that, blood needs to flow in and out of the body. So what I do is I connect blood vessels together in their arms, make sure I keep them working. So when they go for dialysis, they have a place that they can hook into to run into the artificial kidney. So, I can prevent you from having strokes. I can help people on dialysis. And then as you come a little lower down, there's another condition called aneurysms. So we typically talk about blockages. Aneurysms are the opposite. The vessels can start ballooning up. If they get too big, they bust. And if they bust, almost no one makes it. So if you find an aneurysm, and I'll tell you a little bit how we find these different problems. So if I find an aneurysm, I can fix it. And most of these things nowadays, we can do them with very simple steps. In the past, 10 years ago, we had the major surgeries. Now we can fix them with stents. I think we did an aneurysm in February in Barstow Hospital. The patient went home the next day. These are procedures that can be done with stents. They can be taken care of, and patients go home quickly. And as you go down to the legs, if you have blockages in the blood supply to the legs, you can develop ulcers, you can develop gangrene. And some people don't know it. When they walk, the legs cramp, the hip hurts, they think it's all bone problems. A lot of them could be vascular problems, especially if you're above 60. So anyone above the age of 60, whether you smoke or not, a fourth of them will have some blood vessel blockages. So if you let it go for too long, that's when you come in with gangrene. Again, you can treat most of these with balloons and stents. You can avoid amputation. Then there's also the problem of varicose veins, which are, those huge swollen veins. People think it's a cosmetic problem. It can also cause pain. It can cause ulcers. We can treat a lot of those in the office with a simple laser procedure. There's a lot of things we can do to keep people healthy. Now, how do we find these out? Most of the vascular problems, you don't know you have it until something really bad happens, like a heart attack, right? Most people could be walking around with blockages in their heart. And the first time that we know they've had blockages in the heart is a major heart attack. Now, it's very hard to examine the heart, but the good thing about the blood vessels I'm talking about is most of the times you can examine it without anything very invasive. When you visit a doctor, if he just puts his hand on your feet and he doesn't feel a pulse, You're supposed to feel a pulse in your feet, just like you feel a pulse in your arms. If you don't feel a pulse, patient needs to come and see me. Your blockage is the blood supply. Every primary care physician, typically when they check the pressure in your arm, they should be checking the pressure once in your leg if you're above 60. And both the pressure, if you just imagine the blood pressure all over your body should be the same. Let's say our upper arm pressure is 120/80. In the arm, in the leg, it should be 120/80. If it's anything less, the blood vessel blockage. Then he puts a stethoscope to your neck. If you have a blockage in the blood supply to your brain, the blood tends to flow making a noise. And like you take a little hose and you squeeze the tip of it, it flows faster, it starts making like a noise. If you hear a noise in the neck, you probably have a blockage. And then the next test isn't an invasive test. It's just an ultrasound. It's the same machine you do to look at babies. You can look at all the blood supplies. You can look at the blood supply to your neck. You can look at the blood supply in your leg. You can look in the belly if they have an aneurysm. So it's a very simple screening. So typically, if you can pick most of these up, the only problem I think in Barstow that we've had for many years is most people haven't been doing these tests. When they've done them, they don't know what to do with them. So now we can, we can find these problems. We can solve them. We've done more than, I've been here since mid-January. I think we've done a little more than 60 vascular procedures at Barstow Hospital. The hospital has been very kind. They've got me most of the equipment I need. Dr. Gordon is very good with all the screening. He looks at, pulses in all patients, does ultrasounds, listens to the stethoscope. Then we're able to proactively treat these people so they don't end up with a major vascular problem. That's kind of what I do. I'm here usually 4 to 5 days a week. As we're getting busy, we'll find more people to come and help me and back us up so we can keep most of our patients require the care of the local community. So that's pretty much what I do. Thank you.
Thank you, Dr. Cassie. Really, I think all I can say is that, it would be very hard to vision in a small community hospital and for a small community that we are able to do such a big vascular surgeries and the procedures. Doing an aneurysm surgery, stenting, and the carotid surgery. These are the surgeries which are done at Loma Linda, UCI, and the big tertiary hospitals. So those surgeries which are being done at the tertiary hospitals and we go there to get these surgeries done are now done at a Barstow Community Hospital with the help of the vascular surgeon, Dr. Cassie. It's a really blessing. Believe me, every patient, the dialysis patient, patients with kidney problems, they have a lot of problems. And I'm seeing in the last 2-3 months, the amount of the patients we have seen at the hospital surgeries, they say, my God, such a big relief and blessing for all of us. So I think we'll keep that going on. And I think we are very excited that to take this to another level of doing higher procedures, vascular surgeries, and opening the town something new like an outpatient lab or something like that. So thank you, Dr. Cassie. Now I will introduce Dr. Reddy. Dr. Reddy is our integrative medicine physician. He has been in the community for, I would say, 30 plus years. Basically, he lives in Barstow. He's a Barstonian. A lot of us know he is a veterinarian. And of course, I think, we all have pets, dogs, cats, and horses. And I think he's been treating them. And one of the very good veterinarians I have met in my life. He went to medical school, did medicine, and then went and did 4 years of his integrative medicine at San Diego. So with his all knowledge of his veterinarian medicine, integrative medicine, he has all these thoughts, ideas to cure the people, not talking of just treating the patients, but curing them. And of course, so he has got this all knowledge of the medicine to cure the patients. And I think I would like to certainly listen to him today to see what are the different treatments or therapies or things are available to help us out in our chronic medical problems, chronic illnesses, which cannot be treated by our regular physicians or regular things which we have. So I think he is going to enlighten us with that. And I'm really also looking that he's starting his practice in Barstow very shortly. And I think Barstow in a few years will be a famous town on the world map for doing a very good integrative medicine. Dr. Reddy here.
Good morning, ladies and gentlemen. It's a pleasure to be here in my hometown talking about medical care and health news, Like Dr. was saying, I've been here almost 35 years as a medical agent. And then I went to medical school, became an MD, and then I went to become another medical school to become a naturopathic doctor to start an integrative practice. The reason why I did that is not that medical education, the MD, the allopathic medicine, nothing seriously fundamentally wrong with it, but it has its own limitations. The pharmaceuticals, the drugs, they have their side effects. And there's a big thing coming up all over the United States now, a new movement is to stay away from harmful drugs if possible. Because allopathic medicine has done a lot of good things also. They have performed miracles. And like I said, so there is a room for a different thought, a different opinion as to how to bring about a change in the medical care of people. And what this involves here, what I try to do is the integrative medicine, which means a combination of both the traditional and the modern methods. Traditional methods have their own significance. They have done quite a few amazing things. For example, yoga, you know how it does. It has its own advantages in many respects, in chronic diseases and things like that. Of course, if you are in an acute emergency case, yoga is not going to do anything, but they have their own place in the medical care of people. So, I really thank you for, first of all, Dr. Gautam, to have arranged for me to come and talk to you about. I'm getting to know the people in this town. I'd like to introduce myself again, and I would like to be a part of the community and help you out as much as I can. So what is integrative medicine? Integrative medicine, like I said, is a very broad certain doctrines. It has some principles in it. For example, the first doctrine of the naturopathic medicine is vis matrix naturalis, Latin word, meaning that in us we have an inherent power, a vital power in it. That is called in Chinese they call it Qi. In Sanskrit it's called Prana Shakti. So there is in us, we are not just an accumulation of tissues, organs, and bones and skeleton. We have certain powers within us. If you let that power take over and guide you, then all the obstacles will be cured. And provided you take care and remove the obstacles that are preventing the problem from solving in the first place. So that's the vis matrix nature, the power of inherent nature in us that we need to strengthen that, okay? So, and then what we do, we look at the being, the human being, the patient in totality, not just doing a particular exercise in a particular organ or a system or cells or anything like that. You look at the whole being. It's called teletotem. And then this telecosm is the next thing is to find out what is causing the disease. Not just suppose, for example, if it is rheumatoid arthritis. We do not go and just try to give some medicines to control the inflammation of the joints and stuff like that. So the cause of the rheumatoid arthritis, there is because of the gut. There's the gut-brain axis, there's the gut-heart axis. The origin of all these autoimmune diseases is in the gut. So we need to get to the cause of this rheumatoid disease, the gut dysbiosis, imbalance. But what is causing that again? So we need to find the cause of the cause again. This is how we get to the root cause of the problem that is causing the imbalance in the whole body. So, and then we try to be as a docere. Docere means a doctor as a teacher. So a doctor has to be really a teacher. And if you do not educate your patient, what's so good in doing everything else? Because you have to educate them. You have to educate them in the art of prevention and proactiveness and things like that. So in an integrated regular clinic, the way we do is to first emphasize on food. Food is the fundamental thing for a human being. That's where the imbalances all start because our food is not balanced. In America these days, we have these dietary things going on. Everybody is on a diet, high protein, high carb, low fat, stuff like that. The best thing is to have a balanced diet. And we talk about protein, carbohydrate, and fat, and there's another fourth thing that many people don't even know about it. That's called fiber. This is as important as any other thing. So the food plays a very fundamental role in a patient's health. Talking about food, there is something very interesting. There is a thing called food allergy. Everybody knows what that is. If you eat some fish or some shrimp or something like that, you have an allergic reaction, like bumps and lumps, right? And then you have food intolerance, where certain people cannot tolerate certain food. For example, African Americans, they cannot drink milk because of the enzyme lacking in them. It's called the lactase. Between the two, there's another thing that many people do not talk about that does not exist in the medical book. That's called food sensitivity. This is the reason why they don't talk about this is the problem, the effect of the food that you are eating today, which does not agree with you, does not manifest until 3-4 days later. That's why they never connect those two together. That's called food sensitivity, and there are certain methods of finding that out. It's a very sophisticated technique. Almost some of them fall in the realm of quantum physics. There's another thing I should talk to you about, the application of quantum physics in medicine, in healthcare, and that's coming up. It's called bioenergetics and bioresonance. And you must have heard about light frequency and stuff like that. So medicine is moving so fast. In the future, not too far from here now, there's going to be a new kind of diagnosis. They're just to hook up the machines to the body, and the body will give you the frequencies that are coming out of your body due to certain organisms, and then they will send the frequency back to the body, and that will neutralize the toxins or destroy the parasites and bacteria and stuff like that. Almost sounds like a very futuristic medicine, but that's coming up soon. This is called bioresonance. Okay? And then what we do here in naturopathic medicine, we do phytonutrient therapy, which is called botanicals. These botanicals, they have tremendous power of antioxidant power, anti-healing power, and removing certain bacteria, also antibacterial. According to CDC, they are saying now the era of antibiotics is over because the bugs have gotten so clever that the antibiotics are not working. In this, believe it or not, in the phytonutrient world, botanicals, there are antibiotics, natural antibiotics, like natural statins. They are working very well to solve the problem. And then, of course, there is another medicine called, you must have heard, it's homeopathy. This is nothing but pure quantum physics as application of that. In homeopathic medicine, there is no medicine, yet it works. How does it work? It's due to this so-called by energy. It's energy medicine. It's the impartation of energy into the body, and that's how it heals. And then we have IV nutritional therapy. You put a catheters and you put the nutrition, vitamins, minerals, anti-cancer drugs for cancer patients. We can give nutritional therapy. So, and then we have so-called, we study these tests. We conduct tests to find out what is the gut doing, what's the gut-brain axis, what is causing the problem in the gut. It's called the leaky gut. That is the root source of the source of all the problems in the body. The medical problems arise from the gut. It's what the old ancient saying said. That's because all the food that we are eating is disrupting the internal organs and the internal the lining of the intestine and causing these problems. It's called autoimmune diseases. That's the root cause of that. Now they are saying high blood pressure is possibly an autoimmune phenomenon. Parkinson's, autoimmune. Now they are saying Alzheimer's is autoimmune. Rheumatoid arthritis is autoimmune. So all these things, this root cause of all that. And another thing we talk about is epigenetics. Most people think their diseases, for example, diabetes and stuff like that, is genetically related. No, it's not. Most of them are also, the real truth is they're epigenetically controlled. Epigenetics is about genetics. It's a combination of the environmental and your genetic factors put together. So if you have certain genes, that does not mean you are going to get the disease. It's like giving you a loaded gun. As long as you don't pull the trigger, you're not going to do no harm. So it is the environment that's causing the problem. It's called epigenetics. And there are certain ways to test what epigenetic influences you are under. Those are called genetic SNPs, single nucleotide polymorphism tests. And if you do those tests to find out what you're susceptible to and providing the right nutrition, we can prevent you from getting into those diseases. It's a very clever way of doing it. And then we study the stress. This is one of the biggest things in our American life here. Spiritual stress, emotional stress, mental stress, physical stress. Stress is the root cause of all that. We study the link between the adrenal hormones, the little tiny gland that sits on top of the kidney, and their control to the thyroid hormone, and into the pituitary under the brain, in the brain. So we try to link all these things to figure out what is causing the problem and try to harmonize all those imbalances, and we correct the problem. And then, of course, there is this thing called environmental medicine, probably one of the most important things in America right now. Every American, in general, has up to 160 toxins and chemicals in his body. Every newborn baby in the umbilical cord has close to 100 toxins, out of which they say 30 or 40 of them are carcinogenic, cancer causing. So our environment, our bodies are full of toxins. Now the new mantra is don't count calories, count the toxins. In women's beauty makeup is full of toxins. There is a way to detoxify and biotransform these things. So I like to do all this to help you out. And when I set up my clinic, I'll let you know. I will announce it, and I'll be more than glad to help you guys. Okay? Thank you for helping me.
So we have a wonderful, wonderful, interesting thing happening today, which I'm really excited about. And I want to thank Mr. Lyle, Dr. Bagg, Mrs. Bradford, and our wonderful high school. We actually have 3 sets of students here today. We have elementary, we have high school, and you're at the college. You know what that means? Higher education. So we're prepping you. And it's so wonderful for all the schools to come together and bring the students out to learn and to see what the expectations are. Because I am a mom, the expectation is you will go to college, you will go to university, you will do something magnificent in life. Why are we doing these health fairs? For some of you to think, oh, this is over my head, I don't understand what you're talking about. You see this body that you're starting with here, and you guys are all about 10 years of age. And then this side of the room, they're about 16, 17, 18 years of age. And over here, I'm 21. It's a fact, don't laugh. So the idea here that each physician is trying to emphasize to you is the body that you started with as a baby, that you have as a 9, 10-year-old, that you will have as a teenager, is the same body that you will maintain as an adult to the day you die. So what our job here today to do with you on a very fun and an exciting level is to teach you how to make this body work for you throughout your life. It's to teach you the fundamentals that you can take back to mom and dad at any age and say, hey, this is what we need to do, because it's never too late to start. As long as you have life, there's opportunity. The moment you stop living, there's no opportunity. And there's, I love you. You get that amen a little louder, okay? Everybody together. Amen. Listen, who's going to be the best group here is going to get pizza. So is it going to be Barstow Christian, or is it going to be Barstow High School? I knew they could do it. I knew they could do it. We'll still get together. I've had the blessing and the opportunity to talk at Barstow Christian Academy. I've had the privilege of talking at Barstow High School, and I've had the opportunity at the college here. So we're truly blessed. But there's somebody that you haven't tortured yet, guys. It's the other Dr. Gotham. And Dr. Kasi, and Dr. Reddy, and Diane, and Leo. Leo, my favorite one. So I'm going to bring them all up here, and I want you to pound them with questions. Questions about yourself, questions about mom, questions about dad, questions about the aunt, the grandmother with diabetes. Why, when you eat something, I feel really good, but 20 minutes later, my energy is down? I know a lot of you play sports. This is a great time to ask those questions. What do I need to do to be a great athlete? When I'm a great athlete and I sustain an injury, what do I need to do to take care of that injury? Will this injury be a short-term thing, or will this be a long-term injury? Is it something I'm going to have for the rest of my life? How do I take care of this sophisticated machine that God has given us that no man has been able to replicate to this day? That's the human body and the human brain, right? So you guys do not even realize that you are walking computers. You're walking machines. Computers don't program us. We program computers. So who's the most sophisticated body right here? We are. So let's say thank God for that. And now Leo, please join me. Dr. Barber, please join me. Miss Diane, please join me. We are going to take these questions, and it's going to be like we're playing tennis. We're going to swap it right back to them and hit it out of the park. So give them lots of hard questions. I know each of you have a question, whether it be for you, whether it be for mom, dad, grandmother, and aunt. I had a really great kid from STEM who gave me such a wonderful presentation on diabetes because he loved his grandmother and he wanted to find out what was the best diet for grandma to follow. And he hit it out of the park. So I want to see you guys do it. I know Barstow Christian has it. So let's see those questions for all of you sports people. Why do you get tired on the field? You're not eating properly. So let's start with those questions. Caleb, so what's your question?
So, if you have type 2 diabetes, you just have to stay eating healthy and that's it?
Good question. Type 2 diabetes usually you usually get it as an adult. The risk factors for type 2 diabetes are, yes, an unhealthy diet, lack of exercise, being overweight. So what you want to prevent further complications of the diabetes that can lead to heart attacks or strokes. So what you can do to prevent is to exercise, is to make healthy food choices, and also to control your stress levels. So not just eat healthy, but also exercise.
Yeah, and if diet and exercise doesn't work, you're gonna have to have your mom and dad see the doctor so we could start treating it, because they have insulin resistance. They will need medications, insulin, so the diabetes will not get worse. It will not affect their health further. Diabetes kills. You could lose your eyesight. You could have a kidney failure, right? People on dialysis, most of them are diabetic, and their diabetes is not controlled for a long time. You see these people have amputation, their toes, leg. Those are diabetes that's poorly controlled. So it's very important. If the diet and exercise does not work, have them see their doctors, okay?
How many of you love getting injections? Okay. So if we come and give you injections, you love that injections? I mean, only 2 people said they could love injections. Rest everybody is like sitting with their arms tied up. No? Huh? And the injections, let's say we give injections 4 or 5 times a day. How many of you love it? 4 or 5 times a day, because we may give you injection, whoever is raising their hands. Try to see.
Austin, that's a shot, right? In your arm or your leg? Oh, yeah, so injection is a shot. You break out that needle?
Well, I still kind of liked it because it hurt that much.
I don't know. My office anytime. I keep all the shots.
Oh, flu shot first.
So I think the most important thing is to understand for the kids is if kids develop diabetes, it's mostly the one they will be requiring shots. Because when you develop diabetes being so young, most of the times your diabetes will be managed by giving shots every day, 4 times a day, 3 times a day, poking your fingers every day with those needles, and it becomes really, really bad. I have seen kids, they just hate it, they cry, and they just, but because you did, once you don't take care of your health, and that's how it happens. So the most important thing for kids to stay away from diabetes is eat healthy. What do you mean by eat healthy? I mean, if you ask, what do you mean by, okay, let's just start with that. Yes, go ahead. What do you mean by vegetables on daily basis? What vegetable and how much? Maybe 1 teaspoon of vegetable? So at least you see like at least half a cup or a cup of vegetables, right? Every day we should have that, right? So that is important. Not eating too much of pizza, right? Okay, go ahead.
When you mean eat healthy, means do not eat too much sugar.
You're right, very good. Not eating too much of sugar. And which has the most sugar you guys are eating every day? Go ahead. I think sodas, right? Sodas and all those drinks, lemonade and this and that, right? So look at how much sugars you're taking every day. So when you take so much of sugars, your body cannot digest that sugar so much. So we need to cut back on the sugar. Maybe just 1 drink a day and rest of the day just water. Because if you take that much of sugar and eat all the unhealthy food, the fried fruits, the fries, all the chicken, fried chickens and everything, oily foods, it's all going to increase your risk for diabetes. So every day having at least a cup of vegetables, some nice fruits, apples, pears, peaches, and vegetables like broccoli, and this is very, very important. And every day, running miles, at least half an hour, you should be exercising, running at least 1 mile to 2 miles every day. So exercising and good healthy eating is very important if you don't want to get diabetes. Go ahead. What is the liver cancer? What?
Is liver cancer deadly?
Liver cancer is very deadly. Again, liver cancer stems from what? Eating unhealthy, your liver becomes fatty. Fatty liver means too much oily foods, bad foods. Lot of going to the restaurants, lot of going to the McDonald's, Carl's Juniors and everything. If you ask my son, all he eats is McDonald's. That's it. So, but it's nice that you need to understand taking care of your health is very, very important. And I think eating vegetables and this is very important because it will keep you healthy. As like Dr. Reddy was saying, health, the stomach is the main thing. If you eat healthy, your stomach is healthy and you will have less medical problems and less toxins in the body.
Okay, we have a question over here.
Yeah, go ahead.
What's the best diet to have? Or essentially, what is the best diet?
Veggie diet?
What is the best
No,
diet?
like so I think your question is, there's so many advertisements about keto diet, low carb diet, high fiber, all these diets. Your diet essentially has to be good according to your lifestyle and your health, your current health. Make sense?
Well,
So you want to elaborate on that?
I'll have Diane. Okay.
So, like Dr. M was saying, that your diet has to go according to your lifestyle. If you live a very hectic lifestyle, sometimes it's hard to just cook and prepare meals. But to me, and what I believe is the best foods that you can eat are foods that you cook yourself. There's a lot of foods out there that are processed. They're high on fat, high on salt, high in cholesterol. And if you keep eating that way, then you're going to gain weight. We get to have what's called atherosclerotic disease, where your vessels of the heart or vessels in your body start to narrow due to plaque. So if you're living a very healthy busy lifestyle, it's important for you to maybe prepare your food, learn how to prep food, and it can be very simple. Your vegetables, very balanced meals like proteins, incorporate good carbohydrates, and reduce refined sugars, drink lots of water. The more natural, the better.
Definitely. I think, if you stay away from too much processed foods, too much salty foods, sugary diet, I think you'll be fine. If you incorporate more fruits and vegetables in your diet, high fiber diet, I think that's best. Meat versus fish, barbecue fish will be better for you, right? Red meat versus chicken, barbecue chicken will be better for you. So.
So I think the most important thing for a good diet, I think the few things is that, of course, backing off on the sugar is very important. So instead of using the white sugar is very bad. So I think there is, the other alternatives to sugar is using cane juice, raw cane juice sugar. So raw cane juice sugar, if you start using as a kids or in high school, like whatever you are right now, I think that will help you a lot. So very simple thing to do in life is get away the white thing. So white sugar, replace the white sugar with organic raw cane juice sugar. That's one thing. Number two, oils, vegetable oils. Use less vegetable oils. Because if you use that oil, a lot of oils, it creates a lot of burden on the liver. And that causes, a lot of the burden on the liver causes the digestion to become weak and cause a lot of medical problems. So if you can just start backing off on the white things, white sugar, the white salt, and the white flour. So anything three whites, the white flour, white sugar, and white salt, and replace the salt with the natural or the rock salt, white sugar with the organic cane juice sugar, and the white flour with brown flour, or you can say brown rice, or the whole grains, whole wheat or something. I think it's the biggest thing you can do in your life, kind of that. So, right?
Well, some people know about it, but they came out with Gatorade Zeros. Are those healthy? I know.
This zero is basically means the calories. I mean, I think the Gatorades and all these Cokes and everything, the sugar content is very, very high, and it's all white sugar. As we say, the whole day we are taking white sugar. We are taking white sugar in bread, in the tortillas, and everything. So we need to cut back on the white flour and say brown rice, and doing other things like taking the other kind of flours, which are whole wheat or whole grain type of things, is better. So three white things: white sugar, white salt, and white flour, and vegetable oils. If we cut back on that, I think that's the biggest thing we can do for our life. Go ahead. Well, I think, we have Dr. Dijon is the cardiologist, and he just, he's a busy cardiologist, so he came in right now. So we will just refer that question to Dr. D, because I think there's nobody who can answer heart better than Dr. D. So Dr. D.
I'm not going to belabor you about the physiology behind keto, but in a nutshell, to answer your question, when you go in keto diet, you're substituting your carbohydrate intake, and carbohydrates is an energy source. Your body likes, there's three sources of energy: fats, carbohydrates, and protein. And it takes the longest for carbohydrates for your body to burn off. So if you cut back on carbohydrates, you're gonna lose weight no matter what. But the ketosis is your body is robbed away from your carbohydrates, and it's gonna get other things to get energy. Your body needs fuel. It's gonna start getting the fuel from your fats. Fats are complex carbohydrates that are stored. So when people go on the keto diet, get rid of your carbohydrates, you lose weight because you're bringing up the fats. And what's left, if you continue to be off the carbohydrates, your proteins suffer. That's why they ask you to increase your protein. And the keto diet, they substitute for the other fats that you think are not as healthy, such as cheese, heavy cream, avocados. They're high in fats that are healthier compared to polysaturated fats or so. So in a nutshell, if you go on keto, you will lose weight. If you get off keto, you will gain it back. But it's a lifestyle changes. And I'll give you an example. Before I got here to Barstow, I was in Phoenix, Arizona, and I was in a large cardiovascular practice, and we were in a large hospital. And 3 other cardiologists and 3 other cardiac thoracic surgeons, we saw each other. They go, "Hey, you guys are losing weight." And like, "Yeah, we're on keto." I go, "Well, I'm on keto also." So we got on this keto challenge. One of the cardiac thoracic surgeons who was diabetic, in fact, improved his hemoglobin A1C, a measure of his diabetes, and his cholesterol went down. But keep in mind, not only do you have the diet, you have to exercise. So, and I just came back from the American College of Cardiology in New Orleans, where they had a discussion about lifestyle changes in the keto diet with some of the panel discussions with some cardiologists. And they're all for it, but with the caveat, curtail your carbohydrates and exercise.
So does it affect the cholesterol?
Yes, because you're gonna go reverse ketosis, and you're gonna prevent because when you eat a lot of carbohydrates, what you don't burn off, you're gonna go through oxidative process and convert those carbohydrates to free fatty acids, which are converted to fats. But that's like 2 years of biochemistry that you don't want to go through.
For the young ones, can you let us know what the energy drinks like Monster and Red Bull, how it affects the heart?
That's a good question, and as I would say, do not drink. I'll give you an example. There was a patient I saw in the ICU, a 19-year-old, came in with shortness of breath, very fast heart rate. Bottom line is, he took a lot of the energy drinks, Monster, Red Bull, Rockstar, whatever what he took. And he took it for a better part of a year and a half. He did it because he liked the drinks. Number 2, he was always, he worked several jobs, and he always had to be up at the hours of the night. The energy drinks in itself, because they have a high content of ephedra, or in a sense, amphetamine derivatives or so. And what happened was it damaged his heart. It damaged his heart to the point that it enlarged. So there was an added insult with the energy drinks, damaging the heart muscle. The heart muscle recovered, but recovered abnormally. So his heart just got really big. And when it got really big, he got into heart failure because it was not pumping effectively. And he was prone to having heart rhythms that could cause him to die suddenly. When you see those shows on TV, where they go like, "Oh, he's coding," and they shock him or so. That's what he had the potentiality of going through or so. Because he was a young guy and he was end stage, we decided to transfer him out for considerations for heart transplant. Yeah.
Does spicy food affect you?
It affects me. I think spicy food, if you're saying, does it affect you in terms of the heart? No. It affects you in terms of your GI tract, your stomach, and the bottom side of you, probably depending on what your body does. So.
So if you forget to bring your cooler and you work out a lot, would that be like asthma or something?
Now you're on inhalers because you have asthma?
My friend that when I do soccer.
Okay. Well, people who are on inhalers, especially young people like you, have a component of asthma, lung problems or so. But you don't have to have, when people exercise, no matter what the course is, you're basically increasing flow of blood to your rest of your body and flow of blood to your lungs. And those cause dynamic changes in the pressures because the heart's pumping harder and faster. There's a component, but when you exercise, you can go into an asthmatic attack. It's called an exercise-induced asthma because of the inflammation of the exercising. And that's what they usually recommend if you have that type of condition is to do an inhaler, prevent from your lungs, the vessels to constrict. So that's not exactly a bad thing. I do have that. You also see that with conditions like very cold situations. If we were like, I grew up in the East Coast, you know, it's really cold there. So when you go out, the cold weather causes a constriction of your vessels and your pulmonary vessels, and that causes like an asthma-like symptom. So having that in mind, when you exercise and you get prone to that, inhaler will help you out. Because we're all old. The answer to your question is, if you think about it, people who are growing older in life, your heart has been pumping blood. Your heart starts to develop in 3 weeks into conception when you're born. So you think about it, your heart's been pumping blood and working for 3 weeks, and if you're like 75 or older, it's been pumping in for a long time. And a lot of that is wear and tear on the body, a lot of that is wear and tear on the heart. And if people continue to do things that are usually bad, such as smoke, drink alcohol, or do any bad drugs, that can put more stress and damage to your heart, your blood vessels, your body. And that's why we have more heart disease as we grow older. People like you who are young, I don't expect you to have heart disease unless you're born with it. And you have known about that by your parents. They would have told you that a long time ago.
When you go to the grocery store and they have organic vegetables and then regular vegetables, are buying the organic ones really more helpful to your body than, I'm just curious, they charge you twice as much, so.
No, in terms of the content of the vegetables, I don't see, I think it's organic because it's free and clear and control of pesticides or so, supposedly. But I mean, if you're getting organic lettuce compared to regular lettuce, I don't want to pay that much for organic lettuce. I get the regular ones. So.
Asthma attacks kill you.
That's correct. That's correct. I had a 17-year-old girl who died of asthma. She died of asthma not because it killed her. She died of asthma because she did not want to take her medications.
Hey, I have some family members, when they were younger, they loved their vegetables, fruits, and everything, just ate it all the time. But as they got older, they don't eat that much. What can I do to get them started back on vegetables and fruits and all that? Sometimes they even gag it up. They don't like it, they'll throw it up.
That's a preference, I think.
I know.
But I don't know how to answer that. And I'll be honest with you, I guess when we were young, I remember when we were young, my mom said, eat your broccoli. I go,
yeah.
Well, and she goes, there's people starving. And I go, well, they can have my broccoli. They don't want to. But the thing is, as we grow older, our taste defines. And as we all grow older, the food we eat is more accessible and easier because of fast food, processed food. I'll be honest with you, it's easier to pick up those rather than do your own meals or so. And of course, a lot of these processed foods are high in fat and high in salt. And that's what gives taste to food, okay? If it were for salt and fat, it would taste like crap. I mean, who would eat that? But my feeling is, there are certain foods I like, certain foods I mean, I'll eat broccoli, I'll eat cauliflower, but I would not eat Brussels sprouts. I don't know why, because it just stinks when you cook it. So my feeling is, it's a rather a preference or so. Now, to cajole them to eat stuff, I have no idea. Unless you tell them, I'll give you a pizza, you eat all this stuff. I mean,
Yeah. Well, he loves pizza.
why don't you put broccoli on top of the pizza?
Yeah, but he loves pizza, but he's backed up on all his fruits and vegetables. He does eat apples, but we kind of like force him to eat apples.
It's fine.
And he eats corn. He likes corn.
Right.
That's him. He just doesn't like his all his vegetables like he used to eat when he was younger. He'd chow down like anything, and now he just kind of stepped away from it,
Well, a lot of vegetables, the benefit are the vitamins and the fiber content. So young people,
They go through stages.
yeah.
So don't worry about it, huh?
Uh,
Okay.
I went through yourself already. Yes.
Can you please name all the side effects of short-term memory?
Can you say I forgot?
May you please name all the side effects of short-term memory loss?
I think you need a neurologist. I won't be able to handle that. That's beyond my scope of practice. Yes. I'm sorry, what did you say? Because in a sense, when the mother is diabetic, the mother has to fend for herself and for the baby, the developing baby, and they're diabetic. They're robbing the baby of nutrition because the diabetes takes preference. The mother will take all the calories because of that. That's just physiologic. And so their diabetes is fully controlled. The baby does not develop and it can become premature, and that may be the case. That was in medical school, like, that was a long time ago, I can't remember. I'm really serious. I just can't remember how many bones we have in the body. You probably know more than I do, so. Yes.
Can spicy foods promote in your stomach?
No. It can, if it irritates your stomach and you have and it's constant all the time, you can have an ulcer. But that's not the spicy food itself, it's just the acid in your body, your stomach.
How many years does it take to become a doctor? How many years of school?
Okay, if you think about it, you go to college, that's 4 years of college. And that's pre-med. 4 years of medical school, that's why it's 8 years. Once you graduate from medical school, you have postgraduate training, and depending on the type of residency you go through, say for internal medicine, that's at least 3 years. So that's 11. This is the route I took. After I got done with internal medicine, I decided to do cardiology. That's 3 years of general cardiology. So we're up to 14. And I subspecialized in cardiology with transplant and heart failure. That's 2 years. That's 16 years took me to get where I'm at. And with that also is almost a loan debt of probably $850,000. But nowadays, that's when I was there, so I think it can be over $1 million now.
Do you guys believe in like holistic doctors? Think that what they educate versus like an actual doctor, is there like a big difference, or?
Dr. Cobb can probably talk more about that, but to answer your question, holistic medicine, I see a synergy between holistic medicine and westernized medicine. I mean, if you think about in Asia and India, they've been practicing holistic medications for over 6,000 years or more. So, 6,000 years of that type of medicine can't go wrong. Now, I think we're, in terms of what we're doing now, in terms of westernized medicine, is just because that's what we know, that's what we have. The holistic approach is starting to come into acceptance. There are other modalities of medical schools that are a holistic approach, like naturopathy. I'm a DO, that's osteopathy. At the time, over 100 years ago, they thought osteopathy was a quack type science and medicine. But with the DOs, they want to get recognition. It's still 4 years of college, 4 years of medical school, and postgraduate training. The criteria has changed now. I don't think I don't see any difference between what I am as a DO compared to what Dr. Bam is as an MD. If you look at my family, we have 13 doctors. My family, my brothers are doctors. Everyone in my family is an MD. I'm the only DO. So the philosopher DO, they used to do manipulation as part of the holistic approach in treating people with conventional medicine, and there is a need for that. So to answer your question, yes, I think there is a need. I don't think it has gained acceptance, but as people broaden their minds and see other things, I think that are great alternatives in conjunction with what they're going through. Now, if you're saying, should I just do all just holistic or naturopathic approach? That's your decision. I'm not school or trained or that, but to tell you the truth is, I have dealt with a lot of naturopaths and other holistic doctors, especially oriental medicine, where they do acupuncture. So my feeling is, I think there is a need for both types of modalities.
Thank you, Dr. D. I think that was very nice. Dr. Dijon is our cardiologist at the Barstow Hospital. He's a dedicated cardiologist to the community, and I mean, as he said, that he has long years of training in cardiology, so he's very intelligent, and he provides valuable services to the community, and very loved by the patients for his detailed explanations, bedside manners, and everything. So we are very blessed to have Dr. Dijon dedicated to the community. He lives in the town. He's a Barstonian, so we are very proud of that. So once again, let's give a big hand to Dr. Dijon. I think, as to the question say that natural medicine and all that, I think the most important thing is, even though holistic medicine, yes, there is a need for holistic medicine, and both the medicines are important, but I think the most important part of the holistic medicine is lifestyle and diet. So if you look into natural medicine, what they're trying to say is that if you don't change your lifestyle and the diet, it doesn't matter. Whatever treatments are being offered to you, whether it's the herbs or everything, is not going to work properly. So the basic concept of the natural holistic medicine is lifestyle and diet. If we balance our diet, we eat healthy, and we kind of exercise, and so then if you do those things, basically making those changes in your life, I think then you will stay away from the medical problems. But if you just think that, well, I will eat whatever I want to do, I will do whatever the lifestyle, and maybe I'm just going to go to the natural doctor and get herbs, or to go to the allopathic physician and get the medicines, it's not going to help you much. I think at the base, lifestyle and diet have to change. Diet every day, the amount of the sugars we eat, the amount of the salt, the food, the oily, the junky food we eat, every day we are eating is going to affect the body after a few years. So I think it's most important to understand, change your habits right now, good eating, and that's all going to help you. You're welcome. It's nice to have you guys. Do we have any other questions or? That's fine. I think it's nice that kids came out and had some questions, and I think if we can put those small sessions at their school periodically to teach them about the diet and maybe healthy eating in the lunchtime, it'll help them. Thank you, Mr. Bradford. Thank you. Bye, guys.
It's the table. I want to get it going. Careful.
Yeah. Yeah.
I was just asking.
This one.
I've done it for,
And then I understand that you can do that.
different types of vegetables, like mushrooms, or
I will be back at 12:30.